Hello and welcome to the Autism Therapy ABA blog. My name is Sydney and I am an occupational therapist. Today we are going to be talking about repetitive behaviors or stimming. So we all have a stim, or at least most of us do, we just don't always recognize it. For me personally, I tend to twirl my hair when I'm in conversation with people. Some individuals may click their pen when they're working, bite their nails when they're anxious, stroke their chin when they're deep in thought, or even bite the end of a pencil when they're nervous about something. Now these are all considered stims. Stimming is commonly associated with autism. The word stim is actually short for self-stimulation. It can also be called repetitive behaviors, and other times it's called stereotypy. Now, the difference between an individual with a diagnosis of autism and a neurotypical individual is that many times when you have an autism diagnosis, the stims actually disrupt everyday activities and learning opportunities as well. Now, not all stims are considered bad. Stims can come in many different forms and shapes. They can be repetitive motions with a body part or an object, or they can even be a repetitive vocalization. Now, some examples can include flapping of the hands, banging or tapping objects, head banging, humming, or even just repeating a phrase over and over again. Now, you might be wondering, why is my child stimming and how can I stop it? Well, there are many reasons why they may stim, but we're going to get to that in a second. First, I'm going to address the second part of the question, how can I stop it? Now, the short answer is you can't always rid of them, but you can reduce them a lot of the time by replacing them with more functional alternatives or sometimes even finding something that is more appealing than the stim itself. It's also important to remember that sometimes leaving a stim is just perfectly fine as well. A lot of the time when a stim is not harmful to the individual, it's actually more embarrassing or unwanted from the parent or caretaker than it is from the individual with the diagnosis of autism. Now, let's get back to the why. Childmind.org lists 5 reasons why an individual with autism may be stimming. Number 1 is overstimulation. Self-stim can actually block out the overload of a sensory input that may be occurring in the child's environment. Understimulation, on the other hand, is when stimming is used to provide sensory input your child might be needing in their environment. Now, number 3 is pain reduction. So it's actually shown that repeated banging of a part of the body can actually reduce the overall sensation of pain. Number 4 is emotional management. So both positive and negative emotions can actually create a spurt of a stim. For instance, excitement can cause hand flapping or jumping, whereas on the other hand, anger can cause destructive stims to occur, such as self-injurious behaviors. And finally, number 5, self-regulation. A stim can actually serve as a calming or relaxing purpose as well. Stimming happens for a reason. Before punishing the stim, it's really important to understand the why. Don't discipline a stim because they're there for a reason. Instead, in its place, try managing the environment to reduce the stereotypy, or even try and find an alternative to the repetitive behavior.